started yet. Sorry. Hello. Right. I started. Yeah. Okay. Right. We have started. We have officially begun. So this question that I was about to avail you with goes a little bit like this. Are there any complications if a cyst is near a nerve? Yes, there are complications if a cyst is near a nerve. So the good thing about cysts is that they are kind of within the skin. They are skin lesions. So it is less of a worry for a cyst than, for instance, a lipoma, which is underneath the skin. So a lipoma would be probably more kind of dangerous, I suppose, than a cyst, but nevertheless, the same principle applies, that when you remove these lesions, you are aiming just to remove the lesion and you're aiming to leave everything around it alone. But there are certain areas where there are nerves nearby that could be damaged, and they are often damaged but anaesthetized with a local anesthetic, but they can be damaged and battered and bruised and knocked about, and they can sometimes be cut. So and this is usually nerves around the head and neck area, and the kind of areas that there's certain areas where there's particular nerves. In this area here above your medial eyebrow, there are two nerves that go up and supply your scalp. They're called the supraorbital and supratrochlear nerves, and they supply the sensation to the scalp. So they are sensory nerves. They are not motor nerves. They supply sensation. The motor nerves come here. So the sensory nerves go like that. So sometimes if they are damaged, there can be a kind of strip of skin on your head that has abnormal sensation. It's not a massive problem. It is a little bit uncomfortable if you comb your hair, or if you had any hair. For those of you lucky enough to have hair, it might be a problem when you comb your hair, but it sort of feels a bit weird. And as I say, they could be damaged if you've got lesions that sort of above the medial eyebrow. Usually that means that they've been pushed and pulled about the local anesthetic or anaesthetize them, and they come back in maybe in a few days if it's the local anesthetic. But it can be a few months if they've been, knocked and pushed about. Nerves do take a long time to recover, and sometimes there's a risk that there could be a permanent damage to them. But as I say, that would probably be more of a risk with a lipoma or something a little bit deeper, as opposed to a cyst. So I think a lipoma would be more dangerous. In terms of the motor nerves that supply the face, they come here from kind of around your ear, and certainly here up in the temple area. There's a nerve here that comes up and supplies the eyebrow. It's called the temporal branch of the facial nerve, and that supplies makes you raise your eyebrow. So in some, if you have a lesion in this area, skin cancer is the other one, particularly with the skin cancer, because you kind of have to remove that area that the skin cancer is in. So if the nerve's in that area, you kind of have to remove it because you don't want to leave any of the skin cancer behind. But even so, with a lipoma, it could potentially be damaged as well. And with that one, that means that you'll be unable to raise your eyebrow, which so that is a motor nerve. That's a movement nerve. That's the movement will be affected. I mean, it's not kind of massive because you can move your eyes. It doesn't affect your eyelids. It just affects your eyebrow, that you might not be able to raise your eyebrow. But I think it does feel a bit heavy and it's a bit uncomfortable. It's not very nice if you have damage to that nerve. But as I say, it's not kind of like a cosmetic consequence. You can't really tell by looking at someone if they've got problems with that nerve unless they try and raise their eyebrows and only one of them goes up, which is not a common event for most people. But if that's important to you, raising both your eyebrows, and you've got a lesion here, then that's something that could be taken into account when you're deciding whether to have it removed or not. So yeah, around the sort of face, there are potential areas where a nerve can be damaged if you're having a lesion removed. But with a cyst, you tend to just go through the skin, and then the cyst is right there, and then you just take the cyst out. So a nerve is at less risk with a cyst removal than it would be, for instance, with a lipoma removal, and it's at less risk with a lipoma removal than it would be with a skin cancer removal. So kind of depends what lesion you're having removed, but there are certain areas that there are nerves nearby that we kind of are aware of and would talk to you about before having surgery. What is the recovery time for areola reduction? So areola reduction is a procedure where you get a scar all around the areola. The areola is the pink bit around the nipple, and it's initially quite puckered because an areola reduction involves taking a donut of skin out, and you suture a big circle into a small circle, so it's kind of all a bit cinched up and a bit rucked up when you first have it done. Having said that, we aim for the wounds to be healed in a week. In terms of recovery, have we got other recovery time questions? In terms of recovery time, it's pretty similar for pretty much every operation I do, and that means if it's an areola reduction, if it's a mole removal, if it's a tummy tuck, if it's a breast augmentation, pretty much every surgery that I do, the aim is for those wounds to be healed in a week. So we aim for the wounds to be healed in a week. So you have a dressing on for a week, and then you normally don't need a dressing after that week. However, with an areola reduction, because it's all rucked up, there are often bits that aren't quite healed properly, and there's a little bits that you can get a little bit of bleeding and what have you. So we will say to you, look, wear a bit of gauze in your bra, because sometimes it's not kind of completely healed. So it might be a couple of weeks for it to be completely healed. But you'll be able to do things, you'll be able to work and go out and about and what have you. But I would avoid doing anything too strenuous with your upper body if you're doing weights and things like that for probably 4 to 6 weeks, and then just start getting into it. But in terms of how you're feeling, you'll be feeling pretty good, I would have thought. I mean, it's a bit uncomfortable maybe for the first day or so, but you'd be able to kind of go to work and function pretty well, unless your work involved lifting heavy weights. If you're a weight lifter in any form for work, then I would say that a month before you start getting into it is what I would say in terms of recovery. Hi, Jackie. How do you decide how much skin to remove with a tummy tuck? Hi, Jackie. How are you? So what I do, and I guess, well, people are probably different in their approaches, but I would imagine it's broadly similar. So what I do is, first thing you do with the tummy tuck is you decide where your lower incision is going to be, and your lower incision is usually in the sort of above the top of the pubic hair. If you've got a cesarean section scar, you put the incision a little bit below that cesarean section scar, so that cesarean section scar is removed at the time of the tummy tuck, so you only have one scar, so you'll replace your cesarean scar for the tummy tuck scar. So you make the incision in the lower part of the abdomen, usually from hip to hip, certainly for a full tummy tuck, and there's kind of like usually a kind of crease in the lower abdomen where you make it, and kind of that is set because that's where you start. So you make your incision, and then what I do when I'm marking patients for a tummy tuck, I will kind of do a dotted line. I will make a mark in the upper of the upper part of the excision that I'm going to make. So there will be a mark of like an ellipse of skin that I'll be removing, because you really you kind of have to go above the belly button. So you kind of got to get above the belly button. But obviously it varies about how much spare skin you've got. So if you've got a lot of spare skin, you might kind of go up from there, kind of like an M shape. But you kind of have to go to above the belly button. So I'll make a little dotted line as to where I think I'm going to be able to make my upper incision, but I don't make that incision. You don't cut both out. You cut the lower incision out, and then you undermine. So the surgery involves undermining on top of the rectus fascia. So you go through the whole thickness of the skin and the fat, and you go over the rectus fascia, which is the basically the anterior abdominal wall, and you undermine all the way up to the rib cage. So then you're left with a huge you cut around the belly button, so the belly button drops in. So you've sort of, the belly button's not attached. Well, the belly button is attached, but it's not attached to that piece of skin anymore because you've cut around it. So you've then got this huge piece of skin which you've undermined all the way up to the rib cage, and then you pull it down as much as you can. And what we do in theatre is we do something called breaking the table, which means that the table is bent, sitting up and legs up. So you're like in a bent position before we actually, and then we'll pull down as much as possible And then there are different ways of doing it, but I put your hand underneath that flap of skin that you've undermined, and you pull it down as much as possible. You put your hand where your incision is, and you press up to make a mark on the skin to see how much maximum amount of skin you can remove. And then you draw your upper mark, and then you cut your upper mark out. But you make that second incision intraoperatively. So whilst I will do a kind of dotted line or give it an estimation of how much skin I can remove, that sometimes I can remove a little bit less, sometimes I can remove a little bit more. So I will see how much skin I can remove in theatre. So as I say, we break the table and then pull the skin down maximally. And there are things called Toledo forceps, which are these big things, which you like calipers, which you can put one on the skin incision at the bottom and mark the skin at the top. But the principle is the same. You just pull down as much as you can, and then you mark it with a marker pen as to how much skin you can remove. You then make that cut, and then once you've made that cut of the upper skin and the specimen for the tummy tuck comes away, you kind of hope that you have got a bit of a gaping wound, but you hope it's not too gaping, because you've got to remember they're in a bent position, so you can hopefully close it. It's usually under a bit of tension, but hopefully not under too much tension, because you've got to remember they're bent like this. But sometimes it's under more tension than others, because you're really pushing it. You're trying to take as much as you can out, but you've got to always get the balance right, because there's a risk you can take away too much and the skin doesn't heal up properly, or you take away too little and they feel that you haven't done a good enough job and the skin's not tight enough. So it's always a balance in terms of the nuance as to how much you take out, but that's kind of how you work it out. You do the undermining first and then you mark it. Well, that's how I do it. I think that's how most people do it that way. I don't think many people do the top cut before they start surgery. I think that's quite a standard way of doing it. Don't know if I've explained that, Jackie. If you could see the op, you could probably understand it a bit better with that pulling down bit and the undermining and all that sort of stuff. Thanks, Jackie. Nice to see you. Nice to get involved. Thank you. What is the reason to stop smoking prior to having surgery? So the reason is that smoking delays wound healing. That's the simple reason. Every time you have a cigarette, the nicotine will reduce the blood supply to your skin. It's very bad for your skin. So if you're worried about your skin, and if you're having a sort of tummy tuck or some kind of skin tightening procedure, then you can help yourself a lot by not smoking, because that will make your skin tighter. Your skin will be lax if you smoke a lot, because it damages your skin. But anyway, specifically for surgery, every time you smoke, it will reduce the blood supply to the skin, so it will increase your risk of wound healing problems. So it depends on what type of surgery you have. So we just talked about tummy tuck. So tummy tuck, the skin is closed under tension. As I say, you have to bend the table in order to close the skin. So it's closed under a lot of tension. So if you have wound healing problems in a surgery that you're closing under tension, and that basically means body contouring surgery, tummy tucks, breast lifts, face lifts, arm lifts, thigh lifts. So any sort of body contouring surgery, if you have a wound healing problem, when wounds closed under any of those operations under that tension, it will just ping apart and it will be a nightmare, to be honest with you. Wound healing problems can be a nightmare with these operations. And so personally, I don't operate on smokers for those operations, not because I've got a problem with anyone who smokes or anything like that. It's just because the wound healing problems can be pretty catastrophic with those operations. And so you don't want to risk the wounds not healing up. So, it's essential if you're having one of those tummy tuck, breast lift, breast reduction, arm lift, arm reduction, face lift, any of those sorts of ops, it's essential to stop smoking. If you're having another op where the wounds are not closed under so much tension, so a mole removal, cyst removal, lipoma, one of those sort of minor ops that we do, I will always tell people to reduce the smoking, and every time you take a cigarette, it's going to reduce your wound healing. It's increasing your risk of getting infections and the wound not healing up properly. So the same principle kind of applies, but it's not quite as catastrophic. So I will do surgery on people who smoke, but for those ops. But I do say, look, if you can reduce / give up, it's going to give you the best chance of getting a good result. But it's not quite as catastrophic if you get wound healing problems if you're having a mole removed or a cyst removed. So I will still do surgery on patients. I don't insist they stop smoking, although it will be better if you could. But that's why. The question is why. So the reason is for the wound healing and the blood supply to the skin issue. Saying hi to someone. Let's see that. Hello, Finn. I think it is. Hi. Kim. Is it Kim? Sorry. Yeah, Kim G. Right. It's because I've got the flesh coloured top. Hi, Kim G. Will I be able to have my mole removed if I was pregnant and not use local anaesthetic during the procedure? Oh, ouch. Hey. Well, I wouldn't. I mean, if you have to, I completely understand why people don't want to have local anaesthetic when they're pregnant. And I would stand by that, and I would say, look, don't have local anaesthetic, don't have your mole removed. Just leave your mole. If you're going to have your mole removed, it's fine to have local anaesthetic. There's no risk of local anaesthetic with pregnancy. It's just that people who are pregnant tend to not really want anything in their body, which is quite reasonable. And so they don't want local anaesthetic, but it's quite common for moles to get darker during pregnancy. And so I would say, look, I would wait until after your pregnancy, but having done. If you had to have it done, if you're worried it was cancerous or something like that, then I would say, look, let's put some local anaesthetic in, because it's usually only a very small amount of local anaesthetic in. I wouldn't do a mole removal with no local anaesthetic. That's kind of like like some horror film. Ooh, I can't remember. Well, I suppose if it's like a skin tag, I might do a skin tag. But a mole removal, we have to cut the skin and stitch it up. No, that gives me the EBGBs. I would say either don't have it removed or have it removed local anaesthetics. There's only a tiny amount, and it's absolutely fine to have that during the pregnancy if you have to have your mole removed. So, yeah. Personally, I wouldn't do it with no local anaesthetic. Maybe someone would, I don't know. The problem is it's just going to be not very nice for you, not very nice for me. It's going to, hemostasis, we use this little buzzy machine, which can be uncomfortable if you haven't got any anaesthetic there. And, I've also got to put some stitches in, which you're going to be aware that you're uncomfortable. It's going to make it difficult to put the stitches in. It's just a no-go, because you don't need a small amount of local anaesthetic unless you've got a massive mole. But then that's even more reason to have local anaesthetic. If it's a sort of normal size mole, you only need a couple of mils of local anaesthetic, So, how soon would I be able to travel abroad after having a tummy tuck? I'm sure we've had this one. I normally say 6 weeks, because you're going to be a bit uncomfortable, basically. You're going to be a bit uncomfortable, so 6 weeks is the norm if you're going for sort of holiday or anything like that. If you have to go, so it's, I've always prefaced that with saying, well, it's not prefacing it, isn't it? What's prefaces before? Suffix? No. I always say afterwards. Wouldn't be prefacing it. It would be anyway. I always say afterwards, whatever that would be. That if you have to travel, you can travel, because people travel to have tummy tucks. People go to Uzbekistan, have a tummy tuck and come back. Well, maybe not Uzbekistan. I don't know. They go all over the place to have tummy tucks, and so you're not going to be stopped at the airport if you have a tummy tuck and then try to board a plane the next day, because people do that with cosmetic tourism. It is not advisable. So if you're asking me the question, I'm saying 6 weeks for many reasons, not least of which DVT and PE. That's a big thing. DVT, it clots in your legs. PE is where it flies off into your lungs. So that is a risk when you're having a tummy tuck. It's a high risk with a tummy tuck, higher than other kinds of cosmetic surgery. And it's also a risk when you're traveling in an aeroplane. So you don't want to double your risks of that, because it's a serious complication, DVT and PE. So that's a serious thing. But not only that, you're going to be uncomfortable. So why would you travel if you just had a tummy tuck? It's going to be uncomfortable. You're going to be bent over double. It's going to look weird. You're going to look weird. You're going to feel weird. So it's just not going to be great. So I would say 6 weeks, you're starting to feel a bit normal. You're not. It's quite early days, 6 weeks, to be honest with you, in terms of the healing. The scars will be red. They might be a bit puckered up. You probably won't be bent over, but you'll be a bit fragile. So 6 weeks, you'll be starting to get into stuff, but you still won't be kind of 100%. But that's kind of my starting point for people who say, I want to travel after a tummy tuck. 6 weeks is my Kim G has liked the life. That's jolly good of you, Kim G. Must be doing something right. Good, thank you. Yeah, if anyone else wants to follow suit, that's fine. But nope, just Kim G. Okay. Anyway, I'll take that. I'll take it. Can I have my cyst removed if it was infected? No, you cannot. So if it says we've had a lot of these recently, we've had a lot of patients who've had red cysts basically, and if they're red, I'm not saying they're infected. You probably need to go and see your GP to see whether they're infected, see whether you need antibiotics or not. You might not need antibiotics. It might not be infected. But if they're red and angry, then they're inflamed. So they might be infected, but they're definitely inflamed. And it is, for many reasons, not a good idea to do surgery on people who have got red, inflamed, sort of angry cysts. So the local anesthetic doesn't work so well. The cyst wall is often quite fragile. There's often kind of, I've had a few patients where they've said, oh, it's just my daughter squeezed my cyst. It's a bit red. So I'm like, oh, okay, that sounds reasonable. Your daughter squeezed it. But there is kind of inflammation there, and the content's often a bit purulent. Not obvious pus, but it's a bit purulent. The cyst wall's quite soft. It's not really a hard cyst wall. It's quite soft. It's quite mushy. So it's much more difficult to remove the cyst wall. And if you don't remove all of the cyst wall, then it can come back again. And the wound can get infected. So the wound, when we stitch it all up, it can get infected. So there's many reasons not to do it. And so if it's red, if it's not skin colored, unless it's red because the tension of the skin is kind of tenting the skin up a lot and it's kind of always red. But if it's a bit red because it's been, messed about with, or it's sore, a bit angry, it is not a good time to do an elective cyst removal. Elective meaning planned. If it's very red, if it's angry and painful, then you might need an emergency treatment, which could be antibiotics, could be draining it, putting a knife in it and draining it and things like that. We tend not to get involved with that side of things. We wait until it's all calmed down, and then we can look at removing it once it's all settled. But while it is red, we would not advise you have it removed. We would not remove it because it is not it's just not nice doing the surgery, and it's just not nice if the wound gets infected. And it's fine, it's not a massive deal, but it's just not great. It's just not great if the wound gets infected and takes longer to heal, and it's much better to wait until it's skin cancer. So unless there's some kind of strong reason, we had someone, was it today or yesterday, who said they had to go to a wedding next week or something like that. So, but I would say to you're better off with your red cyst, which is calming down by next week, than us doing the surgery today, stitching it up, and you get an infection. If you get a wound infection, because there'll be a cavity where the cyst was, and it can be not very nice. So it's not great going to your wedding with an infected wound. So you're kind of better off going with a cyst that's starting to calm down than an infected wound. And we're not saying it to be difficult. We're saying it to get the best result possible. And it is always best to wait until that redness has settled before doing the deed. Who's that's joined? Shah. Hi, Shah. Kim's like the live again. Come on, Kim. Kim, you're a one-woman live liker. If only they were more like you, eh? Come on. Who's that? Lindsay. Hello, Lindsay. Tracy. Hello. So what we're going to do now is, that's it. Well, I say me. It's a wrap. Kim's liked it. I don't know about anyone else, but Kim's liked it. So if only for Kim, we today has been worthwhile. And so I, without further ado, I am going to wish you all a good night. And oh hello, what's this? Oh hello, look at this. I can change. Oh hello. So yeah, let's just do it like that for us. I'm gonna stop this before it gets out of hand. So I'm stopping the stream.